And now we are going to move over to Dee, who's going to share with you how they are handling keeping people at their clinic, sharing with them, getting them over to telehealth if that's the option they want to do, or if they choose not to do anything, how are they staying connected at all? So she is sharing her information here, and I'm going to let her go to town, and I too will interrupt her as needed if need be. And Dee, it's all yours.
Hey, can you see my slides?
Yes.
Okay, cool. All right, nice job, Bob. I really appreciate that. I think it was super helpful for us too, so I thank you. All right, so we're going to talk today about the scripting that both your front office can use and you can use as solopreneurs, or if you've got patients that have already dropped off and you're trying to get them into telehealth. And so before I get started, the one thing I want to clear up with you guys is this is not where I would normally start with your staff. And so, but I'm going to provide a script today and get you guys through it. So let's first talk about why your front office team members don't use scripts. And I think this is really important for all of us to know as owners or managers of a practice. So first of all, there's two reasons why most front office teams don't use scripts that you hand them. So you get a script offline that a friend gave you and you're like, yeah, I'm going to share this. And you give it to your front office team and they kind of run screaming from the room, or you catch them not using it, etc. Very, very common. Tom, we can't hear you if you're talking to us.
Hey, Dee.
Yeah.
Can you either get closer to your mic? People are saying your volume seems to be kind of low.
Hold on a second. Let me see if I can stop share and I'll increase my mic volume. Hold on.
I hear pretty well, but you guys may not be.
No, I'll crank my mic up. I apologize now. Does that sound better? Louder?
Yes, much more.
Okay, good. All right. Does that work for everybody? Yes, you will get the slide deck. I'll talk to you guys about that at the end for sure. All right, let me share my screen again. All right, so let's go back. Okay, so let's talk really quickly about why your front office team members don't use the scripts that you hand them, right? A friend of yours, another PT owner gives you a script. They're like, hey, use this script. And your front office, give it to them, and then you catch them, they're not using it. And there's usually, what I have found working with front office teams is there's two reasons why your team doesn't use the script. So the first one is they don't understand the theory behind it, okay? And this is something I want you guys to consider. For those of us that are PTs, or OTs, we have a professional degree. And we practice theory-based medicine. So we went to school to really take what we've learned and apply it and design a treatment around it. And that's really important to consider because this actually applies to your front desk. What happens is your front office didn't go to school to learn how to effectively manage their patients. So we put them in this position, they haven't gone to school for it, and they struggle. And then you, as a result, will struggle with that. The other thing that happens is our front office team members see themselves as a receptionist, whether it's because we hired them as a medical receptionist or whether that's just the idea that they have in the position that they're in. And the reason for that is this. Well, it means that they consider their main responsibilities to be the following. Let's talk about that first. So the first is answering the phones. They see their main duties in the day as answering the phones, taking messages, and scheduling patients. And here's the thing of why this goes awry. And it will go awry every time you have staff and working your front office that think that their job is to answer the phone. So what we need them to be, and what I like to call them, is patient care coordinators. So I don't hire medical receptionists in my office. I actually train my staff to be patient care coordinators, regardless of what job they had prior to coming in. And the reason for that goes like this. A patient care coordinator should and is skilled at the following. They understand the path that a patient takes throughout care. And this is something I really focus on with my programs, and it's really important for you to understand. Every patient that you have that comes through your practice has an exact path that they follow. Their treatment is different based on their diagnosis, but the path that they take from that first phone call through a completed plan of care is very specific, and they have to be managed like that. Patient care coordinator knows how to lead somebody along that path using proper patient management techniques. So again, they have your front office team And the reason that they fail often when you give them scripts is they don't necessarily know how to lead the patient along that path or use patient management techniques to manage their patients. And then finally, a patient care coordinator is somebody who's able to identify and manage common patient objections with ease. So they're really comfortable handling objections. They're really comfortable managing that patient population, which is what you as a PT or an owner or a manager really need from your staff. So why the heck am I telling you this? Well, the reason I started with this is, like I said in the beginning, my number one training is about theory. It's about teaching a front office staff how to actually manage their patients, how to take control, how to use a script effectively, not just use a script. And so normally, if we weren't in a situation that required a lot of haste and getting data out there, what would work better is training them up. But I can't do that today, so hence you're going to get a script. Okay, any questions before I get going? Tom, that you're seeing?
No, you're person. Yeah, no, I'm not interrupting you or anything.
It's okay, no worries.
You're good.
Okay, so most of you don't know me. I keep kind of a low profile. That's a really bad thing on me. Marketing is not my thing, but those that have been my clients will tell you I get results. So I'm going to tell you a little bit about who I am, where I started. I'll make it quick, I promise. And then I'm not here to sell you anything. I want to make that clear today. I'm here to give you something that gets you results as you go through the next weeks or months. And I'm going to tell you why you need to do this. So I'm evals, and I'm a consultant. I'm a wife and a mother, first and foremost. I'm a physical therapist. I did go to school. Like Bob, I've been practicing quite a long time. Unlike Bob, I have not been practicing since the 1970s. Chips to you there, Bob. You're awesome. I am a practice owner. My husband and I do co-own a physical therapy practice in Virginia. And we're a fairly successful practice, but we started out just like everybody else as, low man on the totem pole, brand new, had to hire staff, dealt with all that craziness. And finally, I am the front office guru. And I do consider myself that. And I'm this is my passion. So let me tell you a little bit about how I became front office guru so that you understand where my experience comes from. Because like I told you, I did start out as a PT. So I was a PT for about 20 years, and my husband said, hey, I need you to manage our front office. Had absolutely no experience. What I noticed was that my front office team had on-the-job training. They had not gone to school for this. They did not have the skills necessary, and there was lack of confidence. So what we found was it was really, really difficult for them to manage patients. Our arrival rate was 75% when we started really me managing things 8 years ago. We had inconsistent collections. We had a super high AR of patient responsibility. Our evaluations per week were hit or miss. It was 3 some weeks, it was 8 some weeks, it was 19 some weeks. And finally, our schedule utilization was really poor. Now, my front office team was really, really important to me. I happened to love the 2 young women that worked for me, and I really wanted to see them be successful. They played a super, super important role in the practice, and that's something I stand by. Without your front office team, your PTs don't have anybody to treat. Here's the thing though, most front office teams are not trained for what we need them to do. They were super frustrated because they could hit that low-hanging fruit on the tree, but they could not convert anybody else. So they were getting those patients that called and said, hey, Tom, I need you to fix me right now. But they weren't getting the ones that we were spending a lot of money marketing for. And because they didn't, and the reason for that was, again, because they didn't have skills. They weren't trained to convert calls. They weren't trained to manage somebody effectively using a cancellation program. And then, again, like I said earlier, there was no formal training or systems to help them. So I created my own, and that's really where I got my start. So what happened as I created my own and trained my staff? Well, I'm really proud to say that our arrival rate went from 75% to 95%, and it has stayed at that number even with me no longer in the practice for the last 8 years. Our daily correct collections went from 70% to 98% at the time of visit. So when a patient has an amount due, we collect it at the time of visit. Our schedule utilization was 90% or greater. So our schedule stays full, even as we expand the practice. And our visits kept per week, meaning the number of visits you're prescribing versus the number of visits that your patients are actually doing increased to over 90%. So what ended up happening was I was in a bunch of groups and a bunch of owners started asking me for help. And apparently I was telling my husband that this was something I really, really wanted to do. And so he fired me. And he told me that that was it. He was tired of me complaining about it and not doing anything. And he told me to go do it. And so I basically became the front office guru. So my program is all about helping practices building patient care coordinators. And the one thing I want you guys to understand today is I'm not trying to sell you anything, but I am going to tell you that when this all rolls out, just like you need to make a plan now for how you're going to protect your staff, how you're going to make good decisions, when you're done, if you don't train your staff on how to handle patients really well, Bob said there's a lot of people that are going to need help, and they are, but there's a lot of people that are going to be in dire straits from not working for the last however many months. And so if you don't train your front office staff, you're going to spend a lot of money marketing and you're not necessarily going to convert them. So I'm not selling you anything. I just want to put that out there. Okay, so let's get to the nitty gritty because this is why you all are here. And I promise there is value in this. This is what I do all day long. And any client that I have on this call right now, and I know I have a couple of them, they will tell you that I can create a script for anything. And I can train your staff why they need to use it and how. So let's talk to you about how to transition a patient to telehealth. Now, I'm going to talk about two scripts for two different scenarios, okay? The first scenario is you're still open, like Bob's practice and our practice, you're still open and patients are calling to drop out. And that is very real for most of us. And I do believe that, you know, I'm not here, nobody's here to judge. Please don't judge on here. Please don't put hate mail on here. Some practices are still open. We are open for our essential patients. The other one is for you're already closed or your patients have already dropped out and you want to get them transitioned to telehealth. And in both of these scenarios, if you're going to do telehealth in your practice, you want to make sure that you have scripting in place and a process in place to get them transitioned. Okay, so let's talk first about the one where you're currently open and you're treating, but your primary goal in the next 5 days is to transition everybody on your list to telehealth. And that really should be our goal. So for those of you that were talking earlier about evals, and you can only do evals, I can't answer that for you, but I do believe you should really look deeper into that. And I do believe that if we all push, the APTA will start to weaken that stronghold there and allow us to do evals similar to using TMR or other resources in order to evaluate our patients online. But look at the list you have and make it a goal to get everybody that's on that list to telehealth if they need it. Okay, so here's the process that I've been using with my clients and that we've been using in our clinic to handle those patients. So patients that are calling to drop out of care, there's 4 parts to this conversation. And I promise if you've all put your emails in here and you give me permission, I will add you to my list and I will give you all of these slides. So you don't have to sit here and take notes and frantically scribble. I will send them out today. It's totally fine. So the first part of the conversation has to be an acknowledgement. And I'm going to talk about all of these separately. The second one is to make known what you're doing to keep them safe. Remember, we're open. We're trying to still help our patients. We're trying to transition them. So we're going to make it known what we're doing to keep them safe. The third thing we're going to do is we're going to ask a simple question. And I'm going to tell you what that is. And then finally, we're going to make that shift to telehealth. The thing you need to remember is this is a path, and everything I give is always based on a path. It's always the direction you're leading somebody. You have to, in order to sell somebody on something, you have to know that direction and you have to be very confident in it. And this is what we're using with our front office team to handle our patients, okay? And this is a very specific path that people are using to be successful. So first of all, we have to acknowledge their decisions and calm them down. And I want to take a moment to explain that to you. And I want you to consider the following. Any one of your patients that are calling, they've already made a decision. Remember, guys, this is completely new territory that all of us have entered into. Regardless of whether you're like Bob and you were going to some telehealth in the first place, or you're like, holy crap, I didn't have this on my radar, and now I need to get this in place because I don't know what I'm going to do, and you're feeling the panic. What I want you to understand is your patients have 23 hours a day when they are not in your clinic on the days they're in your clinic. And of those 23 hours a day, they either are looking at news on their phone or they are watching TV, and they're super, super panicked and they're super confused, kind of like the rest of us, okay? So they've made a decision, and the decision is they're going to drop out. They're usually pretty scared when they make that decision, and that fear comes through in that phone call. So before we can actually handle them and transition them to telehealth, we absolutely must calm their fears. So we have to acknowledge their decision. It basically goes, I understand. So let's say I'm having a conversation with Tom right now, and Tom's trying to drop out of physical therapy. I can't do this. I'm so scared. It's really got me nervous. I don't want to infect my mom, right? I'm in a ton of groups. I see this all day long. It's as simple as saying to somebody, I understand. And what I want to make sure you all get from this is we're not agreeing to what the patient's saying, and that's what makes the most important part in this. We want to make sure we're saying, I understand. I understand what you're saying. I get it, Tom. I totally hear you. Right? I understand says, hey dude, I hear you. I get it. Okay. You may have to do this several times. So if I'm on the phone with him and he's pretty chill and he's just like, look, I'm going to drop out, I might only have to say that once. You know what? I understand. But if he's freaking out, like some of our patients are, I may have to do this multiple times until I hear the following. A nice deep breath and that release of air. So your front office team members really need to be listening to what the patient's signs are giving them over the phone. I can't see Tom's face. I don't know if he's chill or if he's like super stressed out right now, but I'll hear it in his tone of voice, and I'll hear it in what he's saying to me, and I'll also hear that nice deep sigh and that release of air. Tom, do you have any questions? You look like you might have one.
No, if you want to, once you get done with all the steps, do one as a demo. We can do. Okay.
Yeah, absolutely. So one thing I want to make sure you guys understand, your front office should not rush this process. Everybody that works with me knows I talk about that phone call with a patient. You should never rush a phone call with a patient. This is really important right now. If I rush to try to go to the next step with Tom, Tom's going to shut me down. Okay? The next step in this process is to make known what you're doing to keep the patient safe. Now, I want to clarify here. They've already made a decision. I'm not saying we're going to change their mind. Could you? Absolutely. We have changed some of our patients' minds. They are still coming in. They feel very confident because we've made changes in our clinic in order for them to be seen and be safe. Okay? But this isn't about changing their mind. This is about transitioning them to telehealth if y'all are making that plan to close. So again, we're not selling them to come in, and there's no pressure. Hey, Tom, I want to make sure you understand there's no pressure here, right? So I just spent the last 2 or 3 minutes potentially calming Tom down. I totally understand. He keeps going. I understand what you're saying. He keeps going. Finally, I get him to take that nice deep breath. He's quieted down. Now I have to move into here, and I'm going to say to him, hey, Tom, I want you to understand there's no pressure here. Okay. Notice I didn't ask him if I could keep going. I'm very, very clear on statements. Okay. Now I'm going to
hey, I'm going to make a comment here because a lot of you are asking for the slides. We'll send the slides over.
Yeah.
And I think this is going to be to get, like, literally, if you want, maybe actually I'll cut and edit the part where she starts talking about the script.
Yeah.
So that you can literally use this with your front desk, because you can see how calm Dee is with this. You can see how, wow, this is exactly what I need to have with my people to see that, hey, we're not trying to pressure them to come in. So Dee, you're doing amazing. You're making me calm as far as.
Well, thank you, Tom. I appreciate it. And yeah, guys, I'm totally willing to share. This is not part of my program. This is just, hey, I want to help all my fellow owners, because at the end of the day, this is like super important for all of us to be able to master something that's totally new. So like I said, Tom called, I got him calmed down. I didn't move on until I got him calmed down. Now I'm going to tell him what I'm doing to keep him safe. And if you notice, so far, I'm not asking him any questions or for permission. It's just, I move right in. You know what, Tom, I totally understand what you're saying. I want to make sure you understand there's no pressure here. Now I'm going to announce to him, right along with that, exactly what we're doing to keep him safe. So as practice owners, you should have 3 really important things that you've done in your practice to keep your patients safe. I'll tell you 3 of ours. We have a very large clinic, and all 14 of our main tables are in the back. They've all been spread out, so they're more than 10 feet apart, because the number one goal, obviously, is to keep our patients as far apart as possible. Our clinicians are only treating 1 patient at a time. And we've made sure that the tables and hands are being washed before and after treatment. And just to add another one in, our staff are willing to wear masks and gloves if a patient requests it. There's plenty of other things anybody can say. There's plenty other ideas y'all can have. You have to know your patient population to say that. So it would kind of go like this. Hey, Tom, I want to make sure you understand there's no pressure here, but I am going to let you know exactly what we're doing to keep you safe. Okay? And then finally, like I said, have those 3 things and go right into them. So I would say to him, we've made sure that all those tables that are normally in the back are spread out across the entire clinic. We've also made sure that our tables are being cleaned beforehand and after every session, and hands are being washed before and after. And if you feel like it's in your number 1 need to have them wear masks and gloves when they're doing manual therapy, we're more than happy to do that. Okay. Now notice there's no ifs, ands, or buts. I'm not trying to sell him anything, and there's no uncertainty in my voice. This is where your front office team really has to shine. If they sound any bit wishy-washy, if they sound uncertain, that's where y'all are going to struggle, and it becomes an issue for everybody. All right. Now, what I want you guys to understand, this is about gaining a patient's understanding and showing them your commitment. Okay. You have built this patient list, and what I really want to make clear, and I'm going to talk about it later, is you don't want to lose this list, meaning you do not want to become a startup 1 month, 2 months, 5 months from now. You need to continue to warm your list all the way through this process. So this is kind of a warming conversation. We've got the time. We've all dropped in visits. We can put our teams on this. They should be helping the patient see where we're headed with them. The third part in this is to ask 1 question. And this is the question that they should ask. What do you think about this? So I've spent time calming Tom down, and then I shifted Tom into, telling him exactly what we're doing to keep him safe. And like I told you, it wasn't about getting Tom to say, okay, no problem, I'm going to keep going. My fears have been allayed. It's all good. Might it happen? Absolutely. Might it not? Probably. Okay, I'm pretty much a realist here, and I see where people are going. So, but this process keeps leading you toward where you're going. So I say to Tom, what do you think about this? All I'm doing when I ask this question, okay, and by the way, please don't change it. It literally works, and I'll tell you why, okay? All I'm doing is looking for Tom's objections and to get an answer without asking him if he's still coming in or if he's still going to cancel all of his appointments. And this is really, really important. Something I teach your staff in my program is you should never ask a yes/no question. If you ask a yes/no question, what do y'all think you're going to get more often than not? The big fat no, okay? You can't lead somebody down a path when you give them the choice to say yes or no. Okay, so I never want to ask that patient that's trying to drop out, so Tom, are you still going to cancel all of your appointments? Or, so Tom, do you want to come in now? Right? So all I'm going to do is just be like, hey, what do you think about this? And he's going to give me some real basic answer there. And it's going to be, you know what, I think I'm going to stay home. Or maybe it's going to be, you know what, I think I'm going to give it a try. I'm going to still come in. I will say they're still likely to say, no, I think I'm still going to cancel. Remember, you're fighting a 24-hour-a-day news cycle that will not stop talking about number of ventilators needed, number of people that are going to get sick and die, and there's a lot of panic out there, and none of us know the real answer to that. So we're not trying to tell anybody what to do. We're not trying to make our patients wrong. Now, this is where we lead to the telehealth discussion. So we calmed Tom down. Right? I got him to chill out. I told him exactly what we're doing to keep him safe. And that's more just about getting Tom on the same page with me, kind of seeing, getting him to see how important he is to us as a patient without making him wrong about his decision. and without sounding like I'm really super worried or stressed, etc. And then I shift into asking him the questions. So what do you think about this? I listen to his objections. I listen to his confusion. I listen to any problems that he might have. And then I'm going to transition him right into telehealth. Okay. And I'm going to do this by announcing exactly what we're going to do. Again, this is where I have to sound super certain. Okay. So this is important. It's never about asking if the patient wants to go to telehealth. It's about announcing to them that you're going to put them into telehealth or e-health or whatever y'all want to call it. Okay. You want to make sure you acknowledge their decision. And I'm going to talk a little more about this as we go. And then tell them what they're going to do. So when I say acknowledge their decision, in the last slide, I asked Tom, so what do you think about this? And Tom gave me his answer. Either it was, yeah, you know what, I'm still going to come in, or, you know what, I'm still going to cancel all of my appointments right now. Now, we've already said he's a patient. We have a responsibility to help him recover. And we want to make sure that we transition him into telehealth any way we can. So when I acknowledge his decision, he gives me his decision. And like I said, he likely said, you know what, I'm going to still cancel. I understand. These two words, they're super powerful and they're just super easy to say. So Tom tells me that. I say, okay, I understand. I did not tell him, I agree with you. Great idea. Great job. Yeah, that's a good decision. But I also didn't say, hey, dude, that's not a good decision. And I didn't try to pressure him. Okay. Because we all know where this is going. We don't know when. But we all know that we're going to, things are going to continue to close until we get a handle on this. So we want to make sure we get them into telehealth. So I'm going to just say to him, you know what, Tom, I totally understand. This is what we're going to do for you. Okay. So we're going to say, I completely understand. This is what we're going to do. We're going to transition you to telehealth so that we can continue with your care. Okay. Notice there's no option there. Tom's an adult. He's quite capable of giving me his own thoughts and his opinions, but there's no question. Hey, would you like to transition to telehealth? Absolutely. Don't use those words. Tom, we're going to go ahead and transition you to telehealth. Okay. So this is where you got to tell them what telehealth is. Because if you're like me, I'm not saying I don't know what telehealth is, but that word alone causes a huge amount of confusion for people because they've never really heard of it before. They might have an insurance company that might mind that's like, hey, if you don't feel well, log in on a weekend, and one of our doctors will give you advice, right? Okay, great. Do I have strep throat or not? Oh, you got to go get a culture. That's helping me. So patients don't necessarily have a know and a trust of telehealth yet, and we've got to build that up. So I promise you I'm going to talk about that after I get through this part, because really the same handling for telehealth is for whether you are open and you're trying to transition to it or you're not. Okay, so somehow this slide didn't get updated, so I'm going to apologize right now. It's supposed to say that your patients have already dropped out or you're closed and you want to get them into telehealth. So I apologize for that. But this right now I want to talk about for my solopreneurs, this is really good for you. For my clinics that have already closed or your patients have dropped out, right? We have a patient, like Bob was saying earlier, he had some patients drop out 2 weeks ago, right? Well, we still want to transfer all of our patients to telehealth if we have that opportunity, because it's all about health. It's about our responsibility. So it's a little bit of a different conversation. They've already dropped out. Now I've got to get them on the phone. And in this case, I believe this conversation should be the PT. Okay. At this point, if you've had a patient drop out or you're closed, it really should be the PT calling the patient and handling them. Okay. So there's certain parts to this. And the first one is pleasantries. I can't just jump to how things are going. I've got to actually be like, hey, how's it going? I'm calling to check in on them, and I'm going to elaborate. You have to share what your responsibility is to that patient. Inform them that you're going to transition them to telehealth and explain telehealth and their options. And there's also, you got to know what you're going to do when the patient says no. So let's talk about pleasantries. That's super quick. It's pretty obvious. How you doing, Tom? How's it going? What's new? How's your week been? What are you doing at home? So ask some simple questions and make up the ones that feel good to you with your patients. Like I said, how's it going overall? Do you have somebody checking in on you? This is a good question for your Medicare patients. Hey, let's say that Tom was on Medicare. Hey, Tom, how are you doing? Do you have somebody checking in on you? Is there anything you need? Because maybe I can't do it, but I have a resource. Remember, it's your responsibility to help your patients. So let's talk about responsibility for a second. My responsibility is to call them and check on them. So I want to tell them, hey, Tom, I'm calling to check in on you. It's my responsibility to make sure you're doing okay. So, Tom, I'm calling to check in because it's my responsibility as your provider. So I'm checking in to see how you're doing, and so we can make a plan moving forward. Again, I'm announcing to Tom what I'm doing. I'm not asking Tom if that's okay. He'll tell me if it's not. We've all met those patients, right? They're pretty blunt and honest. The rest of them are like, wow, you're checking in? You didn't just close your doors and forget about me? The next thing you should have, right, I'm calling to check in on him, is I should have a list of questions. And this is where you as PTs, OTs, speech therapists, etc., should really be doing a verbal phone assessment on your patient. Have a list of questions to ask them about their problem, okay? And again, you guys should be making up your own list of questions. It's kind of like doing a verbal evaluation on your patient over the phone. Don't ask just about how's your pain, because somebody who's trying to just get you off the phone and doesn't want to confront that they're still having problems at home is just gonna be like, yeah, it's good. And that's not what we're doing here, where it's all about helping that patient and getting them the help they need. What about motions that are difficult? Ask them what motions are difficult, just like you would during an eval or during a visit. You're just doing it over the phone. How are they sleeping, right? Tom, how have you been sleeping? Has this been affecting you more while you're at home? What difficulties they're having at home? Remember something, guys, we're going into spring and summer. The number one people that are gonna be stuck at home are gonna start doing is going outside and gardening and playing more with their kids or their dogs or exercising. Man, I'll tell you what, I have seen so many people in my neighborhood that are like out for runs that like probably haven't done anything all winter. And I actually drive by and the PT in me is like, oh, they're gonna have problems. And I start to worry. So we wanna really make sure that we're asking them, what difficulties are you having at home? Maybe even ask them, have you changed your activity level? Have you increased or decreased your activity level? Are you getting out of the house to go for a walk? What are you doing? Because you know as a PT, OT, especially my PTs and OTs, you know that down the road that's gonna be a problem, right? You really wanna delve deeply here, so have a list. Maybe have a list of 5 to 10 questions that really apply to your patients and what you want asked, so that when you give it to one of your other PTs, they also feel confident and have it, and they can be filling this out and it can become part of their medical record. Remember, this also will help you determine their needs. So I'm working with a patient. It also helps me determine, does Tom need to go to telehealth right now? Do I need to push really hard to get Tom into telehealth right now? Look, I'm not talking about selling something that your patients don't need. If they were in your clinic for physical therapy, why are they not somebody who would benefit from telehealth? Okay, or even telehealth, as Bob and I have talked about, one of the things we're doing, and I'll talk about this at the end with our patients, is telehealth too. Okay, so if they say no, they're not going to do telehealth, still our duty to check in on our patients in the tough time. Okay, so this all leads you to the telehealth discussion. Okay. So how do we transition them into telehealth as we move forward? Your phone assessment gives you exactly what you need to talk to them about telehealth. If you take good notes on what the patient's saying, you can use their answers to sell a telehealth plan to them. Okay, Tom, so based on the following, and let's say Tom was telling me that he can't get his arm even to up high enough to brush his hair, or he can't button his shirt, or he's struggling to get the dog outside and now he has to walk the dog twice as much because his dog walker isn't coming, right? And so I'm going to use exactly what he said. I'm going to be like, hey, it's my determination that we need to transition you to telehealth. Again, notice I'm not asking Tom if that's okay. If I ask him if that's okay, he's going to give you those. I saw your comments online about, well, patients don't want to pay the deductibles that apply to that, and people don't want to pay for telehealth. And I totally get this. This is new for all of us, right? And so we want to make sure that we have a really good plan as we call these patients. So it's not like, hey, I can offer you telehealth. And they're like, no. And we're all like, oh crap, what do I do now? Because that's very common. So now I've told him about transitioning to telehealth. I've used some of what he said as my tools against his objection, or at least to justify why he needs physical therapy via telehealth or occupational therapy via telehealth. And now I have to explain what it is. Remember what I said earlier, your patients don't know what the hell telehealth is. Many of you, just like me, have questions about how am I going to deliver this? What am I going to do? So I'm trying to give you just some things you can do right now to make a plan that leads both you and the patient in that direction. So it's not as confusing as you move forward. So what the heck is telehealth? If you don't explain it, they won't agree to it. Okay, you have to have a nice little written list of things that describes to them what telehealth is. Type up exactly what your telehealth will entail. There's typo. How it's going to work for you and them. So let's say I'm talking to Tom. I want to make sure that Tom understands that telehealth is going to be physical therapy via video setting. And then I want to let him know exactly what we're going to do. Well, on that video setting, I'm going to work through some very specific actions that help me to assess your mobility, that help me to give you guidance on exactly what you can do at home. I'll be able to see you. You'll be able to see me. I can provide a demonstration to you. You can ask me questions. Kind of feels like we're standing in the same room, right? How's it going to work for you and them? Well, this gives us the ability to keep in touch with you, make sure your problems don't get worse, make sure you're not, suffering in tons of pain.
Hey, Dee, I just want to put this out there because I know what it's like to sit and stand in front of the computer and talk. I want to recap in the sense of how simple you have made this. All right, and the idea of, hey, here's the sentence that they can use. I mean, that actually, when you guys are sitting there wanting to implement and give it to your staff, I mean, you're literally putting, boom, here's what we've used, here's what's worked. Take a second and don't change it and all. And I'm sitting here watching this going, very well done, very well laid out. And I hope, and tons of people are asking for the slides and appreciating and to the degree that you've taken something, oftentimes it's so complex and so much that we are trying to do on our patients, that you made it so simple. So to be able to take something like that and make it simple, I know you have to take a lot of work to get to where it is, and it looks so simple, but you did a lot of stuff to get to the point where you're at. So,
well, thanks. Well, and hopefully this is helping you guys. I would love to know. I mean, feel free at the end. I'm going to give you my email. Feel free to let me know if this helps. This is how my training with front office team members go. But my owners that are on this call will tell you, you become part of my family. And I don't know most of you on this call, but you're kind of part of my family now. So welcome to the family. God help you. No, I'm just kidding.
I know, I'm going to say one more thing, because I think I know you well enough, is that this is drilled in. I mean, she makes them demo it. So when you do it, just take the script that she's doing and say, let's demo this. I mean, Bob and I did that for the presentation before we came on, right? We demoed it. And before we got on, hopefully it went really smooth. And so that's a vital component of it.
Yeah, and that's something that unfortunately I can't give you guys right now, but you can take this, you're welcome to take this, put it up on your computer, sit with your staff, drill it down. For my solopreneurs, this is you, right? You're the PT and the front office. Use it, right? This is totally cool. Okay, so remember, we want to make sure that we talk to them about how it's going to work for you and for them. It's really important that they know what's going to happen. Include what you're going to provide for them. How much time it's going to take. Is it going to take 30 minutes, kind of like the TMR presentation on Thursday? Is it going to take 15 minutes? What's it going to take? What platform are y'all going to be on? Right? Make sure they understand. Then Bob put a really good point out there, and my husband, Mike, we've been talking about this as well. There are going to be patients that are going to be like, I don't own a computer. Okay, do you own a smartphone? Yes. One of the things I found recently, and this has come through all of our schools, we have a lot of kids in our county that are really rich, and we have a lot of kids in our county that go home without food every week, which means they don't have access to internet. Now, the cool thing in our county is every single kid in our county was given a laptop computer by the school system. It's crazy. So believe me, we all, bitched about it last year, but yet all of us are like, oh, hot dog, all of our kids start teletraining on Monday, by the way. But they had to look at that and say, okay, well, what are we going to do? Well, so just so you know, and this is something you can tell your patients that say, I don't have internet. I have a phone that I could get on, but I don't have data, right? Well, there are hotspots now that the whatever companies are putting out there that patients can connect to hotspots. So we want to make sure we're handling that objection because it's real. So get that information in your area. Are there hotspots that people can connect to with their phones so that at least they're on their phone, they prop their phone up on their bookshelf or whatever, their counter, and then they can still work with your PTs so that you're handling those objections that are sure to come. How many times a week are you going to do this? Is this going to be a once a week thing? Is it going to be a twice a week thing? What do your patients really need from you? Remember, this isn't about satisfying somebody. It's not about going with what they feel like they might benefit from. It's what you as the specialists need and what you feel is appropriate. And finally, what's the cost? And somebody asked the question, and I'm curious about this. I don't have this data, but I'm kind of curious. If the states are saying, this is something for y'all to put out there, if the states are saying that it can be reimbursed at 100% of what you would charge in the clinic, this is where my brain goes when I think, well, what exactly does that mean, right? So does that mean that, right, if I have a patient with a $3,000 deductible and I have a contract with Blue Cross and Blue Cross says that I can't decrease that amount and give them a discount because they're in network, how does that apply to telehealth? Now, I'm not trying to put a stop out there. I just want you all to consider, could you give a discount? If the patient pays for 5 or 10 visits or signs up for 5 visits, can you give them a discount so that you don't have to handle that objection of, well, I have a $2,000 deductible and I was paying you $110 to come in every day. Now I don't know what I do. I can't answer that for you, but I think it's something else just to make sure you look into because, if with my out-of-network clinics that I work with, that's a little bit easier because they can create whatever their pricing is. 15 minutes will be this much money. 30 minutes will be this. I estimate it will be 30 minutes. Here's how we're going to go about that. Okay. We were talking the other day, Bob and Tom and I, about how the platform.
Let me share something real quick.
Yeah.
So I had a telemedicine visit on Thursday morning, right? One of the first ones, it was the first one that my primary physician had ever done. And luckily he's a buddy of mine, so I decided I'd be the first one. But before I got on, when the nurse was talking to me, this is what they said. Look, we're doing telehealth. We're not certain it's going to be paid yet. We're not sure how it's going to be paid. And we just want you to know that. And they left it open like that in the sense of, hey, we're at this time. And basically they're saying, now I could have said, hey, what will the cost be otherwise? And she probably would have answered me. But I was okay paying whatever it was for that visit because, I knew it was going to be a short period of time. Yeah. So that I found very fascinating to me is that here's the doctors out there going, hey, we're doing this. We don't know whether you're going to be paid or not, but we may be sending you an invoice or something. And then and I've had discussions last night with Sean Kirk that's saying that get your butt out there, do it because for the benefit and the value that you're going to be giving to your patients.
Right.
All right. Whether in the end you end up getting paid for it or not. And that's from the realm of those of you who may be it's getting you doing something, right? Getting you out there. And then it's also from the realm of that may be more with the brick and mortars that are insurance, but you cash-based people, you guys can get out there right away if you're used to that and doing it. Because again, there's 2 factors here. You've got owners looking to help their practice, but you've got now people who've been let go and they're saying, I still got to make money, and they may be out there doing telehealth too. So just wanted to throw that out there.
Yeah. Now here's another thing, guys. You can offer them the opportunity to pay X amount of dollars toward it. So like Tom's example of the nurse saying, hey, we're not really sure if this is going to be covered and how much is going to be covered. Set your own rates for right now. I'm not saying I would just say, what I would say to patients is, hey, look, that we aren't sure this is going to be covered. However, this is what we're going to do for you. For right now, we're going to collect this amount. And you and I will work it out later on, right? So it's more of a conversation with the patient on how can we work this out later on so that, right? So you get them to pay something up front so that your staff is producing and also seeing the benefits of that production, but also later, then you worry about the other stuff later on. So get them to pay X amount up front. And if in the end you have to write it off because the patient refuses to pay more or whatever, Okay. I'm not an expert on that. But I'm giving you other solutions and things you can look into. Okay. So look, if the patient doesn't have this information right here, if you don't have the discussing points and the important points of what telehealth is, they're not going to be able to make a decision. I'll give you a great example. Several months ago, Mike and I were picking up our glasses at this eye doctor, and there was only one person working, and that person was trying to sell this woman on what, she wanted to buy. And the guy, she wanted to know how much it was going to cost for her glasses and her contacts, and does she get a discount, whatever. And the guy just kept throwing numbers at her. He didn't really have any rhyme or reason, and he didn't have anything that she could look at in writing. So another thing to do is put this in writing so you can send it to them after you have that conversation so they can see it, okay? So this woman went on for 40 minutes because nobody gave her anything to look at, didn't give her the data she was asking for. Make sure that you cover the bases so your patients understand. You then have to ask them if they have any questions. So if I'm laying out telehealth to Tom, the next thing I have to do is ask Tom, so Tom, do you have any questions? So the reason I do that is it opens things up for objections and concerns. Now I want you to understand, it's okay if they have objections, concerns, more questions, whatever, okay? That just means basically they don't understand. So if Tom comes back at me with questions, your staff want to be able to handle them comfortably, and they should be able to refer back to what Tom said in his verbal evaluation, verbal assessment, phone assessment, and how you're going to help to solve that. So handle any objections or concerns. Don't glance over them. Don't think that means that Tom's not going to buy, right? He just said, the doctor just smacked the elephant right in the room there and was just like, hey, we don't know if this is going to be covered or not, but we still feel that, we're still providing this service. Okay. So you're going to smack that elephant right in the head and be like, hey, I totally understand. Let's talk about that for a second. Don't tell your patients what to do. Just give them the reason behind it. So I'm not going to turn around and be like, hey, you'd be stupid not to do this. Or I'm not going to turn around and say, hey, Tom, this is really all you need to do. Or, hey, Tom, this is really what you need. Because the number one thing that happens when you tell somebody what to do is they put the brakes on. They slap their hands up in front and they just take a step back. And we want Tom to take a step forward. So we're just going to talk to Tom about what he just said. He said that his back pain had gotten worse, that he was struggling to get up and down the stairs, that he can't take his dog outside. Let's just say what that was. So I'm going to turn around and he's going to say, I just don't know if I can afford this. I got laid off the other day, etc. Think of the long term on this patient, right? I've got to handle it right now, because if I don't, when we come out of this, his pain and his problems are going to be worse. And guess what? His pain and problems are worse. Is he really going to go back to work in a good situation? No. So we want to make sure that we handle his objections. And it's as simple as saying, hey, Tom, earlier you mentioned to me that, your back pain had gotten worse in the last 5 days, that you're having trouble climbing stairs. And hey, guess what? You're also not able to walk the dog. I'm concerned that if we don't handle this right now, you aren't going to get any better. You're going to get worse. And if you keep getting worse, I'm concerned that you won't be able to go back to work when this is all over. Right? So I'm going to kind of play to the fact that I know that Tom likes to work, and I'm going to use his problems against him. I'm going to keep asking Tom if he has questions until he finally tells me no. Okay? Because I want to handle all of his objections, questions, concerns before I move to the next step. And the next step is to close that sale, meaning Tom's going to say yes to telehealth. And this is how we're going to do it. All you should do is say the following. Okay, great. Let's go ahead and transition you to a telehealth program so that we can properly manage this at home. Now remember what we've done. Regardless of whether Tom was calling us to cancel all of his appointments, our clinic was closed and now we're trying to reach out to all of our patient lists, or our patients have dropped out prior to this and now we're trying to transition them to telehealth, even if we're still open, right? We want to follow this process, okay? So we're on the phone with Tom, we're finding out how things are going, we're really getting the data from him on an assessment. Look, if your PTs don't have somebody to treat and a patient's calling to drop off, your front office handles them in the first several steps. There's no reason they can't put them on a PT who works them through this process. Because again, it's about the PT gathering data and transitioning that patient to telehealth. So this is a script. If the patient says no, remember in the beginning when I talked about the patient dropping off, if the patient says no, I'm still sticking with home, great, we're gonna transition you to telehealth. Let me get a physical therapist on the line. They're going to do an assessment for you, and we're going to determine we're going to give you more data on what that is. So boom, physical therapist takes over. In this situation, the physical therapist is the one that called the patient who already dropped out or is calling to try to build their own list, right? I believe that my physical therapists and PTAs can be building their own lists or taking their own list of patients and getting them signed up for telehealth. This should not be mine and Mike's problem all together. It should be all of us working together to do this, okay? So, okay, great. Tom, I'm gonna go ahead and transition you to telehealth program so that we can properly manage you at home. Again, no question was asked. I did not ask Tom if he would like to transition to telehealth. I told him what I'm going to do because I asked if he had any objections, any questions, any whatever. He said, no. I said, okay, great. My assumption is, boom, he's gonna sign on. Now I got to pause. It means I got to shut up. For those of you that know me really well, you're laughing because I don't shut up. So, but now I got to shut up and I got to wait for Tom to answer. Okay. He's either going to say yes or no. If he says no, it just means that there's some confusion. I'm going to try at least one more time to take him back through what his problems were, how I'm concerned it's going to affect him, get him thinking about the future. Okay. If he says yes, boom, you need to then have a plan for what you're going to do. Are you going to send them invoices, right? Many of your banks have merchant services that you can then, and some of those will let you create an account and a merchant service where you send a patient an invoice. Patient pays the invoice, you get them, and then you can give them a link to Zoom in that invoice receipt that then signs them up for Zoom, okay, or a Zoom call with their therapist. Got to work out those logistics too. Don't let it be a stop. Okay. Tom says no. Okay. I've tried to handle him a couple times. He still says no. Remember something, guys. These patients are going to be stuck at home for a while. So we have to lay the groundwork. So we've spent all this time. Don't fret if the patient says no. Just recognize that we're laying the groundwork for them in the future because their pain's going to get worse. Their dysfunction is going to get worse. They are going to not be able to go play outside with their kids, or they're going to go play outside with their kids and damn if their back pain isn't going to ramp back up again. So we want to make sure that even if we couldn't close that immediate sale, we have a plan going forward. So I want to talk to you really quickly about that. This is what you need to do if the patient says no and you've tried to handle them multiple times. First of all, find out why. Can you tell me more about that? So Tom's going to say, you know what, it's really uncertain times right now. I can't afford this. I got laid off. I don't know what's going to happen. Okay. You tried to handle that objection. I am concerned that you might have this continue. And this is why, based on what he said. Okay. And then, but I always want to start it with understand. So Tom says to me, you know, I really just don't think I can do this. You know what? I understand. Here's my concern. My concern is always what Tom said to me, not what I'm making up in my head, because he doesn't care what I'm making up in my head. He only cares about himself. I don't mean that in a bad way. Sorry, Tom. Tom only cares about himself. Just kidding. But then I have to explain my concerns, like I said, what they indicated. And if they still say no, like I said, don't freak out, okay? This is you got to play a long game here, people. And I don't mean that in a illegal, illicit kind of way. This is a long game. You've got to be thinking about your practice later on, okay? So we're now going to announce to him, okay, well, this is what we're going to do, okay? We're going to continue to follow up. So I'm going to announce to Tom, you know what, Tom, I totally understand. This is what I'm going to do then. I'm going to put you on my telehelp list. And my telehelp list, not telehealth, but my telehelp list is going to help me to check in on you. So again, I'm going to use the following. Okay, like I said, okay, I understand, right? Acknowledge his decision. Tell him you're going to continue to follow up each week and have a set plan of who and times that you're going to follow up with these patients. We've had patients that we've put on telehealth. They're like, look, my wife and I both got laid off in the same day. We have $1,000 in the bank. We don't know what the hell's going to happen. Well, I consider it my responsibility as a practitioner and as an owner to not drop out on these patients. So I'm going to continue to follow up with them. The other thing you should do is follow up with an email. I'm big on this. You have a phone conversation, send an email with the telehealth information for them. So that if their pain starts back up again, they have something to look at and refer to and make a decision. Give them a number to call if their pain or problems increase. Look, guys, you want them to reach out to you. With the HIPAA restrictions released for right now or reduced for right now, your PTs could give their phone numbers, okay? So why are we doing this? It's all about your list. I said it earlier and I'll say it again. We have a practice that's doing between 500 and 600 visits a week up until last week. We took a huge hit when Virginia went batshit crazy all in one day. There's no nice way to put it. But if I do not want to start at 96 visits again like I was 8 years ago, I have absolutely no desire to not be able to hire my staff back. So you're not just looking at this from a patient care aspect, you need to be looking at this from a marketing aspect. If you're like us, you don't want to be a startup all over again. My husband's a pretty stubborn human being. He has 20 employees that he is worried about, and there's no way in hell he wants them to stay out of work any longer than they have to. So you need to remain in contact with your current and past patient lists throughout all of this, because if you don't, you will suffer and you will become irrelevant to them, meaning they won't remember you. Bob's very adamant, and I agree with him, that, by the way, owners, you're gonna be in a very different position when all of this comes out. Don't think about the negative, think about the positive. How much more you're gonna be able to barter with things with staff, and that you're gonna be able, in some cases, to choose the staff that you bring on, right? I am very big on this, that the staff members that are going to be willing to reach out to patients, whether we can pay them right now or not, but those that are committed to their patients and see their responsibility as patient care and willing to keep reaching out to patients and people throughout all of this, they're going to be the first staff that we bring back. And the patients that are like, or the staff that are like, free vacation, or I'm going to hang out, they're not going to be the first people I bring back, right? So I'm looking for commitment from my staff too. And so when all of this is over, like Bob said, people are going to need it. People are going to need care. And so we don't want them to forget about us. I don't want one of the other PT practices, and maybe one of you is on this call that's around us, but you know, I don't want, no offense, I don't want you to take one of my patients that I've spent all this time nurturing for the last however many years, okay? I want my patients to come back to us. And so don't just make it about staying in touch with your patients. Start reaching out to your past patient lists with informative letters, newsletters, email campaigns, phone calls. A phone call takes no more than 5 to 8 minutes just to find out. Let's say it's Bob. Bob hasn't been in for a year. Hey, Bob, how are you doing? We just want to check in. We're thinking about all of our patients. Bob's like, you know, I was just getting ready to call you when this all started. You know what, Bob? We're still going to be here for you when this is over. So the minute things start to turn around, and we're opening up again, we're going to reach out to you again. We're going to be like, hey, how's it going? And hey, by the way, if perchance telehealth restrictions get reduced and we can do evals galore in our state, heck yeah, I'll use some TMR and find out what Bob's restrictions are, right? So remember, you've got to keep yourself in the forefront of their minds, or you're going to be starting from zero, 1 month, 2 months, whatever it is from now. And I don't want that for you. So it's not just about shifting everybody to telehealth. It's also about keeping telehealth moving, keeping your staff producing. And I know Sean Kirk's on this call, and I'll say, hi, Sean. And I know he probably talked about this last night, and I would totally agree with him. You know, I'm very concerned about where this country is going with all these people. We've never had a country like this, probably since the Depression, and 99% of the population of today's world was not truly alive and an adult during the Great Depression, okay? And I'm concerned that there's a lot of people that are gonna be sitting around with nothing to do, and that's really gonna mess with the morale of people, that people are gonna become more depressed, not just about money, but just depressed in the long run. And so I see it as my duty to have my staff doing anything they can to keep up with who they are as a clinician and to see their value and to use that. So regardless of whether they can pay or not, or I can pay them or not, or they're working or not, I want my staff reaching out. I want them to be successful. So anyway, that's my 2 cents on that, because remember, I don't want to start over. No, I really, really don't. And I don't want that for you. So hopefully this helped. So if you want to get these slides, I know Tom will probably release the recording, but if you want the slides so you can drill them through with your staff, I'm going to ask that you email me. Okay. And this is the email address you all can send it to. When you email me, what?
And also know, most people put their emails.
Cool.
We're going to put those in a spreadsheet and give them to Dee so she can send all this stuff out. It'll also be on where I'm going to post it, probably on Facebook. So we'll have all that done for you.
If you have any questions also, you're welcome to email me. You can find me on Facebook. I tend to respond better to email, but put your first and last name so I know who you are. Tell me if you're an owner or a practice manager. That just helps me as well. And give me permission to add you to my list. So as I go forward, and Tom knows about this already, I was already in the works. Man, I've been like practicing for this for the last year and a half. Right now I do private consulting, but what's coming is online, very, very, very affordable online training for front office. And my ultimate goal for all of you is that, remember, when you start back up again, if your front office team isn't skilled, they're not going to be able to convert those calls as easily. So the ability to provide that for you is there. And I want you to have that opportunity. Again, I'm not trying to sell you anything. If you were really impressed with this presentation, imagine your front office learning exactly the same way and having the same data. So feel free to reach out. I'm always here. My clients are suffering just like all of you, and my goal is to help. So hopefully this helped you all. Feel free to ask questions, and thank you. And Tom, thank you.